We're celebrating the 10th anniversary of the Bupa Health Foundation this year, which is a wonderful opportunity to reflect and think about the wonderful work that we've done with partners over the last decade. One of the exciting things about the journey of the Bupa Health Foundation is that we've started with particular initiatives and projects. So the survival after breast cancer study, for example, or looking at postnatal depression. And we develop a relationship with those research groups that has evolved over time. And we've thought, gee, that was an amazing outcome in understanding that aspect of surviving breast cancer. Maybe we can take it to the next step and look at the services that could be put in place. So we've actually had an ongoing relationship with many of our partners.
I think the important differentiating thing about the Bupa Health Foundation is that they fund research that they think has real social important consequences.
We can see from a range of other projects that have been funded by the Foundation that there's an enormous diversity, in fact, of work that's been supported.
You might say we'd found that there was a gold mine. We'd dug the first bit of the gold mine. What the Bupa support allowed us to do was to actually extract some of the gold.
We're very proud of what we're able to do with the partners. They're fantastic people, they're so committed. And if we can, through the financial support, but also partnering with them actively, improve their research and their outcomes and make a difference, it's a real privilege.
At every stage of the process, there have been people who have inputted into our research, and so I can credit them to helping shape our ideas and the emergent research. Whilst there was a lot of awareness about the difficulties that mothers might have after the birth of a child, the research is showing that it really starts in pregnancy. And with Bupa Foundation assistance, we were able to show that treating antenatal depression in pregnancy, is making a difference on infant outcomes. The enthusiasm and the interest in the perinatal mental health area is going to make a huge difference in the lives of mothers and babies when they start off in difficulty.
When we started the research of women's survivorship in terms of breast cancer, it was assumed by a lot of other funding groups that this was a done deal, and Bupa had the foresight to realise that we didn't really know a lot about women after breast cancer and that this was an area that needed research.
The outlook for women with breast cancer is now very much better than it was even a decade or two ago. An increasing number of Australian women are living with breast cancer, and it's really important that we understand the issues that they have to deal with, and particularly understand issues that affect their quality of life. The work that we've done with Bupa's support is going to make a real difference.
The Bupa Foundation has allowed us to explore what happens to people with fractures. And what it's allowing us to focus on now is to be able to identify who are the people who are at greatest risk of having these poor outcomes, increased rate of dying following a fracture, and therefore who are the people we really need to focus on who are going to be doing badly. With the help of the Bupa Foundation, we and the Garvan Institute are at the forefront of osteoporosis.
Before their assistance, we had 4 speech pathologists. Now we have 16 speech pathologists.
We can say that we've assisted over 500 children. And if you think about those individual children and their lives and how they've been positively affected, I think that's a huge statement. I think that Royal Fire West is on a path, and where that path will lead, I hope, is to helping many, many more children in areas that we know there's a huge need.
Some of the biggest problems that old people are going to face include dementia and depression, and the support of the Bupa Health Foundation has been absolutely critical to getting innovative trials off the ground, to seeing whether we really can make a difference for the independent living of older people. They're all areas in which we need to make big differences, and we need people prepared to fund innovative projects. I think we now are on the verge of knowing what are the things that you can really do that make a really big difference.
I think any time that you have information about health and you can put things in a real context for people, I think it makes it easier for people to understand why they should do something or why they don't need to do something.
Our health system in Australia is, second to none, and I'd like to think that we are actually able to absorb these huge pressures and changes so that we actually can have a health system in a decade that is as good as, if not better than, what we've already got at the moment. I'm privileged to work in an industry where it gets you out of bed in the morning, because there's just so many wonderful things that we do, there's so many incredible challenges, and there's so many sort of great, smart people that work in this space.